Hi everyone, welcome to Brush Up, presented by Oral Health Group, the dental podcast where we speak to industry experts to discuss a variety of topics, such as technology, finance, and practice management. This episode is sponsored by Solventum. I'm your host, Dr. Louisa Schultz, a prosthodontist and periodontist based out of Fonthill, Ontario. Today we are joined by Sunny Verdi. Dr. Verdi was born and raised in Winnipeg, Manitoba, graduated from the University of Manitoba in 2016. He maintains a full-time ownership role in a group private practice in Winnipeg. Dr. Verdi received postgraduate training in the latest techniques regarding isolation, adhesion, material science, and aesthetic dentistry. He is a member of the Canadian Dental Association and the Manitoba Dental Association. Welcome, Dr. Verdi. This is a real pleasure. Thank you for joining us.
Thank you guys so much for having me here. I'm very excited.
I know a lot of our listeners are very interested in incorporating digital technologies, streamlining their care. I would love to hear more about how it is you started on this journey, what interested you in it, if you don't mind sharing that.
Yeah, so it comes from a patient experience standpoint. And we all know taking like allergen impressions and PVS impressions and things like that. I mean, it wasn't the best experience. And, when we had issues with the impression or distortion, it became a big issue of bringing people back. And our workflow gets, it's not as streamlined as it could be. And it can be inconvenient for people. So we really wanted to adopt digital technology from a patient experience standpoint. What we've seen from that is that it's totally changed our workflow in terms of being able to communicate with patients. And that's been a huge practice builder for us, because now that we're able to use the digital technology to show people what's going on, co-diagnose, really look at what's going on in a way that I think patients are familiar with. Like everybody's familiar with looking at things in high definition on a screen and being able to manipulate models around and touch screen zooming in and out. It presents things in a manner that they're very comfortable with, which I find really helps us to explain things. And there's not a lot of them feeling like left in the dark. They really feel like they're involved in the discussions. So the way I've seen people accept treatment and the way they understand their oral health better and the outcomes that we're getting have been improved greatly by using a digital workflow. And I think it keeps improving from here the more and more we adopt digital technology. So I really encourage people to start entering that world if there's been some hesitation still.
Yeah, from what I'm understanding, it really helps you better understand the patient's expectations and either meet them or, in that communication with your patient, adjust what that expectation could potentially be. And you end up with happier patients.
100%. It's a huge communication tool in that respect.
From what I understand, this digital journey is a large part of what you do currently for composite veneers.
Yeah, I've been using I've been doing composite veneers for a while now, and we used to just do them all. It was all me. You build up everything step by step, hand layered composite veneers. But now using digital technology to help boost the results that we're getting, it's been a game changer for my practice.
You were mentioning that this makes it a lot more streamlined. And how can do you see the patient for less appointments? Is it more predictable appointments?
Yeah, I find it's more predictable in terms of, there's a huge component still where we need to put the human touch. You need to, polish them up. I spend a lot of time finishing and polishing. But I'm finding by using this digital design, and I'm using a lot of the Filtech Matrix system by Solventum. There's a few different other systems out there in the market, but the one I've been having the best success with is using the Filtech Matrix by Solventum. And what I find is it gets me about 80 something percent of the way there in terms of the result I want to get, getting all the teeth length set up, all the incisal edges set up in terms of having everything balanced on a horizontal plane and getting all the composite material physically on the teeth. It gets me 80 something percent the way there in maybe a 15-20 minute window, which is incredible when you're doing 8 teeth or 10 teeth. In the past, this would have taken me maybe a few hours just to really get into the appointment and get the material going and start to see where we're headed, the material placed on the teeth. But with the matrix, it's like, yeah, it cuts my time down significantly. So I can spend so much more time customizing them and really dialing in the finished result for the patient in less time and less appointments.
You've already described multiple really clear differences with making this, the analog, old school, traditional veneer build up fabrication and doing it now with digital technologies. Are there any other big differences that jump to mind?
Sorry, in terms of what? Can you clarify?
Um, in terms of what you need to prepare, in terms of training for yourself, for your team?
I mean, that's probably one of the nicest things is that it really streamlines into your workflow. You don't need to make a ton of differences. In terms of like my record gathering, it's the same stuff. Like I always have a digital scan. I'm always taking photos because we need to plan out like how long are we going to make the teeth? What shapes are we going to be using? The record taking doesn't change, which is fantastic because you take those same records and you plug it into their online platform. They have like an oral care portal.
Hmm.
Go in there, you have the opportunity to design things, customize them, have the design sent back to you, where you can kind of refine that further and then come up with a result that you're happy with. And I'll say, like, my initial thoughts were like, this is going to be, I don't know what we're going to expect here. And who knows what the design is because I don't know who the designer is on the other side currently. So I wasn't say I was like all in right away, but after doing now a number of cases, I've seen the designs come back like, you know, 4 out of 5 times. I'm super happy with the design. And the one time I do, it's just a little refinement and it's good to go. So the design team has been fantastic. The results we're getting are fantastic. Um, so it's been nice. I haven't had to change my workflow a lot. And it's also given me the opportunity to see what things look like. I could show the patient. We can discuss, like, here's what's going on. And like you said earlier, sometimes discussing the limitations of things and saying, look, based on where we're at right now, this is where we're going to be. So it's nice to be able to have that discussion with the patient if there's any concerns before we actually do the treatment. So it's been fantastic from that standpoint. But yeah, it's something super easy to work into your practice. You need a little bit of training because there are some nuances that you should know about before you just go about placing this. And they offer like a fantastic course. There's a small fee, I think, to sign up for it, but you get it back in materials anyway. So to me, I think it's a bit of a wash, but it's a fantastic thing to do with your patients.
From what you're mentioning, something that really caught my attention is that you mentioned that some of the work, the design work, is done remotely. For people who are just, entering the world of digital and really aren't familiar with printing and how this can be done remotely, could you take us just very simplified step-by-step process of how these veneers are created digitally?
For sure. So, like I said, you have your record taking appointment. And if you go through the website, and if you're not super familiar with doing this yourself outside of the portal, it's fantastic because it tells you exactly what records you need to submit, in what order, and what type of pictures you should be taking. So, that's very helpful. So, you get your records, you got to plan out what you want to do in terms of, are we increasing lengths? How many teeth are we doing? What is the goal? And there's a form that you follow. I will say it's very similar to, maybe you're familiar with doing clear liners through Invisalign, maybe. It's very similar to that. Or if you're using clear liners through their Clarity program already, it really walks you through step by step. So it does guide you quite a bit. So once you have all that information in there, you send off, and then they send you a design in a pretty reasonable time. So maybe I usually see within a couple of days, business days, the design's back. We go, we edit it, take a look at it, make some modifications if need be, which they come back with really quick, and then you're good to go. And then you order that case up, and they prepare everything because the design, printing this matrix is actually quite complicated, but they do a fantastic job of then sending it to you. I don't think you'd be able to print it in your own office. But the beauty of having this system is that, like, beforehand, it would be me talking to my lab tech who may not be familiar with what I'm trying to achieve or how to design composite veneers. They're familiar with digital design, but I think there's nuances with composite veneers in terms of how thick you want things to be and how to plan it out. So it's fantastic to have this resource that, you don't necessarily need to know the lab tech ahead of time. And for those of us who work with a lot of labs, you know that one of the biggest things is lab communication. And it's tough, right? We're always trying to have these goals and things that we want to do, but if the lab technicians are on the same page, but they also can't know everything. So the beauty of the digital world is being able to open this up to this platform and have these results no matter where you live. You could live, in the most remote location, but have access to this fantastic service, have it sent back to you, and still be delivering the best care for your patients, regardless of where you are or which lab technician you know.
It sounds like this system is at the same time simple and thorough and grateful for the user, quite intuitive. It'll let you know exactly what information is required and kind of walks you through the steps. How would you compare the system with, manual, traditional, built-up veneers, or with ceramic veneers as well, for that matter? How long do they last? How's the aesthetic outcome?
For sure. To kind of describe the process a little bit, is that so we've talked about the design process, and they send you back a matrix. It's a 3D printed guide that will help you establish the incisal lengths and the overall like buccal lingual thickness of the material, which is an amazing thing to have. When you're doing them traditionally, I mean, maybe you're using a matrix, maybe you're using the Unica matrix, or whatever, or a Mylar strip, where you're just doing freehand. It's can be difficult to get all the lengths established manually. It's a very time consuming thing, and I've done it for a long time. And the amount of like corrections I need to go back and make, and I'm continuously looking and readjusting things. It's possible, but it takes a lot of like patience and a lot of time. So I think we all have experience doing it freehand. Where this comes in, like I said, when you place the matrix on, there's a lingual portion and then there's a buccal portion that clicks on top of that. But it gets me all of my lengths. It gets me all of the incisal, the buccal lingual thickness ready to go. And you place it all at once. There's little connectors in between the teeth, so nothing's bonded together. So you're able to do, initially 6 teeth in literally a matter of like 5 minutes. We'll have everything etch and bonded. I place a little bit of flowable inside there just to help the material run inside. Then I'm using Filtech Supreme Heated and place that all in all 6 teeth at once. There's these little windows that close down that help you control the buccal lingual thickness, but also the separators go in between so the material doesn't all bond together. You close all the little windows, and this sounds kind of like, you'd have to see the product and it makes a lot of sense. So come if you check out my Instagram, DMD study, you'll see a bunch of cases like that, but just go and Google it and it'll make sense. So you do that and then you cure everything all at once. So it's super efficient. And then you can spend time finishing and polishing, because composite veneers, regardless of the technique you use, require a lot of finishing and polishing. I'm just getting to that step sooner. In terms of like what it does in bringing better quality, I think, to patients everywhere, is that it is an art and it takes a lot of patience. And not everybody enjoys that, like, sitting there for hours and hours and hours and recreating each tooth individually. Some people do, and it is an amazing thing to be able to do on your own. But I think this brings an amazing result to the general population and to the general dentist that's like, I want to bring this service to my practice. I do so many other things. Like, I can't invest years and go to many courses to go and learn how to perfect this, technique doing it freehand. This brings us into their practice and gives their patients an incredible result in such a short time period. So I think it's an amazing thing they've brought to the market.
And now a message from our sponsor. Empower your patients by giving them the smile they've envisioned with the transformative power of the 3M Filtech Matrix system. Stunning restorations go beyond quality and aesthetics. They make a lasting impact on patient self-confidence. Present your patients with the direct anterior restorative solution that aligns with their budget using the Filtech Matrix, a harmonized system that combines a digitally designed 3D printed matrix with our exceptional 3M Filtech Supreme Ultra Universal Restorative. The process is streamlined through the intuitive 3M Oral Care portal, where you create a custom treatment plan. This robust combination results in a solution that not only appears natural, but also stands up to the wear and tear of time. Learn more at 3m.com/filtechmatrix. And now, back to the episode.
It looks like it still gives you the freedom or the opportunity to show off your skill when you're managing, let's see, different effects on the incisal edge, combining other composites to do some finishing touches. You still have that opportunity with this matrix?
Exactly. So for me, getting everything all set up, like my personal technique is now to have it all done where we have the lengths and the thickness all established and the overall aesthetics, the form and the shape is there. Then we can cut back the incisal edge, and that's the beauty of composite, right? Is we can keep adding, we can repair, we can modify. I'll cut back the incisal edge and go layer if I need to. You have the freedom to whatever you need to. Or if perhaps this is like just some transitional bonding before an ortho case. You're like, I just need to get the shapes done. We can go refine things later. It gets you that really quickly. It totally depends on what the patient's expectations are. You can do something in a really simple, quick way that helps somebody out, or you can spend as much time as you want and cut things back and give them like just the most beautifully layered, handcrafted composite veneers. So I do a bit of like a combination that way, but that's what I love. It's you have the freedom to it, whichever technique you like.
And yeah, how can you ensure that the patient's going to be satisfied with the shade, the shape, the contours of those? Can mock-ups be done with this?
I haven't found yet the ability to like print the model before you have the matrix made. I haven't had that service available yet, and then go and do a mock-up from there. What I'll usually do is, if somebody's really worried about how it might look, is I'll do my own mock-up. So that is something that still isn't well streamlined in. I don't think that it necessarily needs to be either, because I think that with composite veneers is an understanding that at least we're not doing, when I do it especially, because I'm not ever preparing the teeth when I'm typically prescribing this. So it's still in some ways reversible. I can go and change things and whatever. So I don't get too hung up on the mock-up as maybe we would with doing some of the porcelain. We're, cutting into the enamel a little bit, preparing. So I find it different that way. Of course, like I said, there is design, but I've gotten to a point where I do so many that I think people see the work and they're like, okay, yeah, like I just want that. I trust you. So it's been, the more you do, I think that step will go away. But in the beginning, I do think that you could show them design. I don't think the design necessarily looks beautiful to a patient. They'll kind of be like, okay. It's hard for them to imagine until they see it in their face and design or see it in person. So that maybe is something that's lacking compared to traditional workflows.
Okay.
But I think once you do a couple cases, you have some photos, people are going to see the results, and then they're like, yeah, that's what I need.
That's what I want. And is there the opportunity to have like a digital mock-up versus a one in their mouth? Can you do a digital to some extent?
The digital, the extent of it is just like on the model, like you just see the teeth. They don't have like a smile design per se with the face building it and showing that part. That we don't have right now. Perhaps in the works, and then that would be a fantastic idea if they could. But I don't think that the where this falls in our as a tool in our toolbox, I don't think it needs to be everything. If that, of course we can keep adding features and doing that, but I don't think it's trying to replace that. I don't think it's trying to replace doing those workflows and porcelain veneers. It has a different place to try to simplify your workflow if you're trying to do, composite veneers or bonding for your patients.
Mm-hmm.
So I don't see it as a bad thing. I don't think we need it either, but you'd have to find a different way to work through that.
One of the big advantages, from what I'm understanding, though, is that it is minimally invasive. You don't need to do preparations. You conserve the natural tooth structure. That seems like a big plus.
It's huge, because we have people coming into practice all the time wanting to make aesthetic changes, and I see a lot of young patients. It's just my patient demographic, and some of them are like late high school or they just started university. So finances can be an issue, but they want to make aesthetic changes, and there are times where it's like, hey, maybe we need to plan some orthodontics or some interdisciplinary treatment. But they're like, I really want something right now. So it helps them have something, motivates them without doing anything irreversible, and then we can make further plans. Or also that they're so young that sometimes the thought of doing preparation with the enamel, even though we do a lot of porcelain veneers, we're super minimally invasive. Like we know that we are, respecting the biology of the teeth. That being said, still having the whole process done of having, preps done, having temps on for a while, trying in the finals, it can be a lot, especially for a young patient. So I'm finding this so useful in getting them to where they want to be in a way that fits within their, a lot of these people are young people, so it fits within their budget. And mindset wise, it's easy for them to get started because we're not preparing the teeth or anything. And it makes them feel really good about that. And so, and it makes me feel great. We're getting such good results without having to do that. So I've been a big fan.
It seems like the timeline is also quite short. You were mentioning that the design gets done remotely, you can see it within a few days. How long is it from your first interaction with the patient to when they can leave the office with their modified and prettier or more attractive smile?
Yeah, I would say that realistically, within my practice and the way I've been doing it, probably within a month. Because by the time you've submitted the design and made the changes that you want to, and that's printed, I mean, being in Canada, it has to come through from their processing plant. So wherever the manufacturing is, it takes a little bit of time to get to us. So I find that within a month. I usually find that from when I approve the design, I would say within two weeks, I receive the product, and then we go and place that. So hasn't been an issue, and they've been fantastic in terms of I'm like, because these appointments I'll book a good block of time for them, and so I'll if something's coming up close, I've been able to message just like, hey, can we get this back at this time? And the team's just been fantastic. Like
You guys
I,
never have to readjust your schedule or your patient's
they've
schedule,
been
right?
really helpful about that.
Yeah.
It's been an incredible tool. The team there has been amazing. I have nothing but good things to say, really. It's glad to the practice.
And for any dentist who is interested in starting to, venture into these digital designs, what would be the first step you would recommend to them?
I think is to photography is a big piece. We talked a lot about the digital world, but I really believe in photography and the power of photography. So if you're starting to do more aesthetic dentistry and you really want to get into that or make that a part of your practice, I think learn photography. I love DSLR photography. I think it's awesome. Start with the smartphone if you want something simple. Like there's so many tools now. Those little lights. I have the MDP light from Curion, which has been incredible to have with the cell phone. That gets you started. But then really you want to take it to the next level, get a DSLR camera, learn photography. It's going to change your world. Once you start seeing what your work looks like in that, and you start diagnosing with that as a tool in part of your exam, it changes your practice, as you've probably seen as well. Like photography is incredible. I really think that you need to incorporate that. And then, of course, getting a scanner so that you're able to enter the digital world, it opens up all these workflows for you. There's so many tools out there. Like I said, this isn't the only way. I've been doing it this way in terms of digitally designing these veneers, but people make layer designs where they have like, you can place one matrix on and it layers a dentin for you, and you place a second matrix on and it layers your enamel for you. They're incredible tools. So photography, get a scanner, enter the digital world. It will give you the best results for your patients, regardless of where you are, which I think is the most incredible part.
That's true. Just entering the digital world will open so many different possible avenues that you can incorporate into your practice. It's really a game changer. As far as patient care and maintenance, is there anything you tell your patients they can or can't do? Is there any special care you recommend for them with these digitally created composite veneers?
Nothing that's outside the normal maintenance, but I'm more than happy to share my tips. I do a lot of this, and maintenance is a big part of this for me because patients would always ask for like how long are these going to last, and of course we don't know. There's some literature to suggest that maybe a period of 5 to 10 years they could expect. But of course, a lot of it depends on the patient, on the diet and how they take care of it, and also the maintenance protocol we use in our practices. So in terms of resin itself, like I'll always tell people diet will be a big part. So if they're having like, a lot of coffee every day and it's black, and especially if it's hot, like heat will affect the outcome of this, right? So, you may expect less time with these and a little bit more staining. If they drink a lot of red wine, if they smoke, things like that. And I kind of go through that beforehand to see like, are you a good candidate for this in the first place? So I try to be selective with who we do this on. So that's a big part. I like to see patients at least once a year to polish them. We all see composite over time. Some people will have different materials that may retain polish longer than others, but regardless, once a year, I like to see the patient to polish. I find that as we see it over time, the higher we keep the polish, the longer we're having patients happy with the results, and less we're seeing staining and things like that build up. So I'm a big fan of that. And also I'll find little corners sometimes that like, hey, look, this maybe corner, not chip per se, but there's some wear here, or, we need to do a little bit of maintenance. So I like to catch things early like that.
Sounds like they're also easy to repair if there is a little chip, a little something.
course, right?
Oh,
Like
the margin that's opened up.
it's composite, so it's so easy. Like having an air abrasion unit is incredible for that. You do a little bit of air abrasion, roughen up the surface, add some silane, back and bond, you're good to go. Which is something that patients love because things do happen, right? And it's incredible to have that feature to be able to easily repair them and touch them up over time. And then in terms of longevity, functionally, having this digital design is so nice because what I used to do is I used to hand layer them. But if I had made an incisal edge too thin, for example, because I had to, totally control the thickness of all of them. If I missed something, sometimes I had a little fracture because I had made an area too thin or functionally it wasn't where it should be. So the digital design helps so much with that. You get the right thickness, and I'm seeing how much stronger these have been in function because it's helping me control that. It's been a huge aid for me in terms of that.
It's been a real pleasure to talk to you about this and just see how effective and really easy a technique it can be, how much it can offer both our patients and the clinicians who are using this technique. And you were mentioning that annual polish sounds like something that can easily be worked into the routine hygiene visit. You just add a few extra minutes with the dentist, and it's not a big cumbersome thing to have the patient come back for either.
Exactly, right, and it keeps them in a regular maintenance. So because they're so motivated to keep those looking good and keep their smile looking good, it's just an extra push to be like, come for your regular cleanings, on your 6-month intervals or 4-month, whatever is required for that patient. It's nice that way, and then you polish everything up, and they're so happy. Keeping those composite polish is a huge thing to having success over time, and I think it's something that we overlook. Like, we place the material, and a lot of times we're used to that just being the way it is, especially in the posterior. Like, are we going and polishing these things all the time? We're not. But when you do it in the anterior, you'll see the effects long term for your patients. It's an incredible tool.
Well, thank you so much, Dr. Sunny. Thank you so much to our audience as well. Thank you for joining us and listening. Be sure to sign up for Brush Up podcast alerts and to subscribe on Spotify and YouTube to be notified every time we have a new episode. Thank you again, and keep brushing up.